the Anodyne channel.
Good afternoon, everyone. Thank you for attending our webinar on non-surgical solutions to knee pain. My name is Dr. John Konopelski. I'm a family nurse practitioner here at Anodyne of Aurora, and I can tell you I have seen firsthand the positive and successful results that we have had with our integrated practice here. Our providers and team of extremely qualified individuals have made incredible changes in people's lives. They've been able to walk with their partners, golf again, and even play with their grandchildren, all because of the different things that we've been able to do to help them in non-surgical ways to live a life pain-free and to do the things that they would like to do. We are very fortunate to have a superior team of providers and support staff here to make that happen. So we're excited about this webinar. I have the privilege and pleasure of introducing to you Dr. Kenneth Olson, who is the clinical director of our facility here. He has been doing this for many years. He'll tell you even more. He is quite the skilled practitioner and quite the expert. So without further ado, let me turn you over to Dr. Olson and enjoy the webinar.
Thanks a lot, Dr. John. And I'll say a lot of the same nice things back to you. Dr. John is a very gifted provider, and we're super lucky to have him on our team. And really, the message today is really about collaboration. We definitely feel that a multimodal approach to knee pain is getting far superior solutions than the single standalone solution. So that's what we're going to cover today. My job today is to show you how and why knee pain is such a big deal. Those of you who are attending very likely are suffering from knee pain or know somebody who is. And I don't have to tell you how debilitating and how much of these conditions affect your life. But we are going to show you a glimpse of what that looks like on a national level, what the prevalence is. We'll talk about typical conditions that affect the knee. And then we'll look at a comprehensive way, a new paradigm to treating knee pain. And really more importantly, is not just treating the knee pain. Very few people just want their knee pain to go away. They want to see improved function, as John said. They want to be able to play golf. They want to be able to travel. They want to be able to exercise more. They want to be able to lose weight. They want to get more out of life, and you certainly deserve that. And our approach is about looking at the systematic approach to healing to really restore and create healing. So my job today is not to sell you anything. My job is to increase your awareness, help share what we do and what's been successful in our office. And if this makes sense to you, if you go along and kind of are nodding your head that, yes, this makes sense, then we're going to give you an opportunity on how to continue the conversation. We can't address each individual concern during a webinar. We can't get into the specifics of your particular case, but we will give you the opportunity on how to do that and more to come on that. So I ask if you just could sit back, relax, and enjoy the show. It's great to come to you in this format. Given our current circumstances, certainly having webinar or seminars at restaurants and these sorts of things we're not able to do. And so I hope you enjoy the ability to do this in a little bit more of a leisure type approach, and you get to sit on your own couch or at your own desk and take this in. So sit back. Listen with an open mind, and if this makes sense, we'll give you an option on how to continue the conversation. So first of all, this is a knee pain, non-surgical solutions to knee pain seminar. And a note on Anodyne Pain and Wellness. So I'm the founder and owner of Olson Chiropractic, which transitioned in 2008 to Pure Health Physical Medicine. And Pure Health Physical Medicine is an integrated approach. It is our chiropractic team, our physical therapy team, and our medical team and our massage therapy team working seamlessly together to help people feel and function better. And in 2017, I made the decision to partner with a group called Anodyne Pain and Wellness. And Anodyne is a nationwide group that is focused on non-opioid treatments for pain and regenerative and physical medicine approaches to restore function. So you will be seeing more in the near future about our brand transition from Pure Health Physical Medicine into Anodyne. In today is one where we start to really represent the Anodyne brand and transition away from Pure Health. What will remain the same is our dedicated providers, our commitment to purpose, our customer service, our patient satisfaction, providing great quality care in a comfortable caring environment. That will all stay the same. So let's talk about the prevalence of knee pain. Knee pain affects 1 in 4 adults, or 25% of the population. It's a third leading cause of disability in the United States. Arthritis is going to continue to increase as our population increases. And arthritis in knee pain is an increasing cost and burden on the healthcare system, because as we lose function of our knees, we see these secondary conditions start to develop where we lose mobility, we lose our ability to exercise. We see things like our weight increase, or then secondary issues like diabetes and hypertension and these more chronic issues. There's over 650,000 total knee replacements done every year in the United States alone. And osteoarthritis is a common degenerative case that affects the underlying bone and cartilage and soft tissues of the knee that then lead to advancing deterioration and destruction of the synovial joint, the soft tissue. So the reminder of that is arthritis is often complicated by soft tissue healing issues where there's been damage to ligament, tendon, muscle, connective tissue, the integrity of the knee itself. So very rarely is arthritis a standalone issue. It's often a secondary issue. So let's talk about what some of those issues are, and maybe some of these terms you've had, or maybe you had some of these injuries as a young adult. So the next little section here is about those common terms or those common diagnoses that we see. And in young adults, often these are standalone injuries. But as we grow older, the macro trauma of that event becomes a significant event over time, or little micro traumas, including these particular sets of conditions, then lead to more complicated conditions, making arthritic and the aging process more complicated. So the ACL is the ligament that spans the front of the knee and helps stabilize the upper leg bone to the lower leg bone. ACL injuries often happen as in sports or in jumping injuries, or in those areas where there's sudden differences in position. Meniscus. The meniscus is that cartilage inside the joint. So this is the cushioning inside the joint. And it forms a rubbery spacer, and it's a shock absorber. Now this is going to wear with age, so there's both chronic meniscal tears, and then there's acute tears that happen after injuries. Bursitis is a very common area that causes a lot of pain, and bursas are little fluid-filled sacs. In fact, the word bursa comes from the word purse. And so these little purses add cushioning or add lubrication to protect ligaments and joints. And unfortunately, as alignment changes or biomechanical changes occur, we start to see these little purses fill up with inflammation and irritation. And that can lead to a lot of pain and discomfort for the patient, especially as they progress over time. So I'm just reminded here too, this is an interactive workshop. So in your chat, there's a group chat. And if you're not familiar with where that is, if you come down to your task button, there should be a more, and you can click the chat. So if you type back and forth, I have staff standing by able to answer your questions. We can also ensure that they'll bring them to my attention and we can handle those verbally as well. So interact there. My staff will also be checking in to see how the webinar is going for you. Not only if you have questions, but if you have the need for particular more information of these sorts of things. So please interact there. Patellar tendonitis. The patella is the kneecap. So kneecap arthritis, or this tendon that connects the kneecap to the shin bone, often can become inflamed. This happens in a lot of people who exercise, runners, skiers, cyclists. That repetitive motion kind of irritates that. We also see this very commonly in women as a result of the Q angle or the direction of the knee. That can become more problematic in ladies. It does happen in men as well, especially as we lose stability of the knee and there's more grating and grinding underneath the kneecap. So there's other types of arthritides, and one of those is rheumatoid arthritis. Rheumatoid is an inflammatory arthritide, and it's an autoimmune disease. So this is essentially when your body starts to attack itself. And the knees are often an area where this inflammatory pannus, it's called, starts to deteriorate the inside of the knee. It's less common than it's less common than the areas where we see degenerative changes, but it's important that we rule that out because it needs its own set of treatments to handle it. This is one that's often overlooked, gouty arthritis, and especially our middle-aged to aging men are more prominently suspect to arthritis. But it's when these uric acid crystals build up, and it can both be a result of irritation into the gouty toe, but gout attacks can happen in the knee as well. And so we have to make sure that we're evaluating that and assessing that. In our particular practice, what patients suggest is unique to us is that we look at the areas above and below a complaint. So very rarely is a knee problem only a knee problem. I heard a professor once say that unfortunately the knee is trapped between two crappy joints, which is the ankle and the hip. And so these changes in stress sometimes affect the knee. Sometimes it can be an ankle or hip injury that occurs first. Sometimes it can be a prior low back issue. But once the gait, once your walk is changed and how you weight bear, we can see this kind of chain reaction of problems. And that's where somebody who does a really thorough functional assessment or biomechanical analysis really can help you get a better result than just treating your knee pain. So let's talk about arthritis. So osteoarthritis is also called degenerative arthritis. And remember, degeneration is wear and tear, much like the wear and tear that your house might go through. So if you found out that the foundation of your house was deteriorating, I'm assuming you would interact or seek a treatment for that right away. You wouldn't wait for the house or the roof to start to crumble. You wouldn't wait for these secondary issues to start to take place. And we stress that because we really stress intervention with arthritis when it's either in its minor or moderate status will produce a far greater outcome than waiting until you're at that end stage. Much like intervening if the foundation of your house is deteriorating, the sooner we get to that problem, the better chance there is for a long-term stable outcome. So arthritis is wear and tear. Oftentimes people think that arthritis is a bone issue, and it's really not a bone issue, it's a soft tissue issue. So on an articular surface or where two bones meet, there's this joint cushioning, and this cushioning adds as a lubricant and it adds as a protective barrier to wear and tear. As that starts to break down, we start to see small little imperfections in that, which are like sand into your engine oil. It adds grit and grind. And then as that progresses, then we'll start to see big sections that start to wear off. And that leaves raw exposed bone, which is now like metal shavings into your engine oil. And then all of a sudden your body starts to make modifications on alignment and modifications to pain. And we see that continues as both the micro trauma accumulates, aging, wear and tear. Osteoarthritis is very common. It is the most common arthritic change. Its predictors are previous trauma and family history. OA affects 10% of men and 16% of women 60 years or older. So if you're having knee pain, you may have osteoarthritis, but you might have some of these other changes as well. So accounts for 80% of the global burden on the healthcare system. It happens when the protective cartilage starts to break away, and it affects most commonly the weight-bearing joints, but it also affects these secondary joints such as hips, spine, hands. We can see arthritis anywhere. Today, we're talking about the knee, and it is in knees. It's extraordinarily common. Again, about 1 in 4 adults. It's 80% of the global burden on the healthcare system. It's really important. If I were to give you one slide to take away from today, it's this particular image here of our scale. Recognize that your body has an ability to heal and repair, and it does a good job with that in most cases. So it has this process to create a reparative sequence of events. Unfortunately, with continued microtrauma, with continued wear and tear, due to family history, due to biomechanical stressors, the destructive process starts to outweigh your reparative process. And that sets the path for additional conditions to start to develop. And one of those is the arthritic process. And the secondaries of that are the patellar tendonitis, it's the meniscal damage, it's the ligament and tendon issues like the ACL and MCL. And all these things start to complicate the process. So our historical solutions in knee pain, let's look at what commonly has been done over the course of years. And the American Academy of Orthopedic Surgeons says, hey, first of all, you should consider losing weight. In our 20-year history, we've never seen weight loss handle a knee arthritic problem or knee diagnosis. It may help reduce the load, but very rarely is that the solution. Exercise and physical therapy. Trust me, we love exercise. We love physical therapy. We want people in great shape. We want you to be able to use that joint. But again, by the time people are symptomatic, if we initiate exercise or physical therapy, there's so many cases that it makes the condition worse, or the exercise and the therapies intolerable. And so then as the pain starts to continue, then we look at medications, non-steroidal anti-inflammatories, or other analgesics, other pain meds. And gosh forbid we start going into this realm of opioids and other more advanced pain management strategies. And we'll touch on those in a minute. And then we really look at this idea of orthobiologics. Orthobiologics is the regenerative products that really help try to promote that healing process, to tip that scale back in the favor of the reparative process versus the degenerative process. And I think most of you attending this seminar would agree that you're trying to either stave off the joint replacement or put that decision way down the road, buy some time before that. But ultimately, in the historical process, this is where we go. Physical therapy alone, again, physical therapy is great and it may be the right solution, but what we found is oftentimes if we don't create healing first, then therapy is not well tolerated. The other issue that we see is there's generally very little coordination with physical therapy. So the prescribing provider doesn't stay actively engaged by physical therapy. So that can be problematic. So we'll talk a little bit about why our office is different and how integrated our physical therapy approach is into the system, into the formula of healing. Look at this list of medications that are used in the treatment of knee pain and knee arthritis. I mean, it's extensive. And I imagine some of you have been through this list. And what tends to happen is we start at a lower one or less invasive one, and then kind of the trend is that we then have to do these step-up medications, and ultimately we end up into these list of opioids, which are very addictive and have their own challenges with great complications and additional risk. So the analgesics are good when they're used properly. They do help us get out of pain, which we'll use to help break the cycle of irritation for somebody, but they're not great for long-term use, and they have their own complications, including increased stress to the liver and the kidneys. And oftentimes we have to do this step up, and where a little was effective at one point, we have to step up and use more over time. And we even start to see this idea that one drug's approved for one purpose, and then we start using it for off-label. And it really is not doing much to improve function. And in fact, oftentimes when we're covering up the symptoms, the progressive wear and tear is continuing behind the scenes. We have these lists of anti-inflammatories and over-the-counter prescription, or over-the-counter meds that also carry some additional risk. And we just share this because sometimes, the message is, oh, it's just an over-the-counter, it's got to be safe, there's no complications to it. And it's really important that we look at what the total impact on the body is on anything that we're putting in our body. And oftentimes in short-term use, that's not as problematic as it is if we start to rely on that over a long period of time. And then again, we get into these prescriptions, and we have used these and we continue to use them. But what we hear patients talk about is they went to their ortho or they went to their primary care and they were given this prescription and no really other follow-up. It was, hey, take this, and when it stops working, come back. And they get kind of frustrated with that because, yes, it's changing their perception of the pain, but it's not doing much to get them back into the game of life. They're not being able to golf more. They're not able to exercise more. It's not helping them with their secondary conditions. So this is an important decision that you have to make in your progression of how you want to manage the condition. And then certainly opioids are the step up and have gotten a lot of publication or a lot of press about their side effects and their addictive qualities. The most important piece of data here is that they don't prevent inflammation, so that underlying wear and tear is often continuing even though our body's not getting the signaling or not getting the information to really reduce those signals or reduce the wear and tear. And then as we step up into those injectables, oftentimes through the orthopedic model, corticosteroids are used. And we'll use a corticosteroid when it's intended to put out an acute new fire. But again, oftentimes this is used as a long-term chronic management situation, and it is not a great strategy to really restore function. In fact, it doesn't restore the cartilage, and in fact, it might actually create more damage. There's research that shows corticosteroids can disrupt the collagen formation around where it's injected, increasing also where it's increasing the breakdown of the cartilage and progressing some of the underlying conditions. So this is the list of these. Recognize some of the side effects, which can increase your blood sugar levels, can increase risk to the stomach, can increase high blood pressure, irritability and depression, cataracts, and osteoporosis, the erosion of the bone there. So, and then ultimately, if we're continuing down that path, we end up getting to the surgery. And you all attended a non-surgical solution to knee pain, so I imagine you're looking for something other than surgery. So some stats on surgery. Average cost is $31,000. I've seen that listed as much as $54,000. We look at a range of 6 months to a full year for recovery. And a knee replacement has a limited shelf life. So oftentimes patients are told, wait until it's so bad, then you'll know that you need to do surgery. We're trying to offer solutions that help restore function before we get to that surgical situation. So I just want to ask if all these things are going on, and this makes sense that, there's a degenerative, destructive process that's happening. the amount of injuries can be multimodal. We can not only have osteoarthritis, but we can have ligament damage, we can have meniscal damage, we can have changes underneath the kneecap, patellar arthritis, patellar tendonitis, we can have bursitis. Would it make sense to look at a treatment solution that looks systematically at the healing approach, looks at stabilizing the unstable structures, and then looks at adding strength and stamina endurance? So if I could show you a way, and I could help you understand that there's a restorative process, that there's a process to help improve function, stave off that arthritic process, would that be of interest to you? And so I don't know if we can help any of you, and I don't know what each of you are suffering from. And I see some of the questions going through here about very specific things about, does Medicare cover this, or does my insurance cover that? And what does your system look like? And I think it's important that we address each of those on an individual basis. So I want to offer you a gift, and the gift is the opportunity to come in and evaluate your situation one-on-one. My staff is going to be reaching out to you to see if this is of an interest, to see if you want to sit down and talk about your particular case on a one-on-one basis, and really evaluate your particular situation. So, and if you do that, we're going to offer that as a gift. It's an opportunity to sit down at no cost. We're going to discuss what's going on with you. We'll discuss your particular situation, and then our treatment options specific to you. If that makes sense, we can transition into an examination and evaluation, and we'll let you know what that looks like. We want to offer a gift. And generally what happens in these webinars is I buy lunch. So we're doing that virtually. Those of you who schedule a consultation and complete that, we're going to give you a gift certificate to our next door neighbors here, AC's Pub, who has amazing food. We're going to give you a $25 gift certificate so that you can have lunch on us. And I recognize I haven't gone into those solutions yet. That's where we're going. So if this makes sense, and as my staff reaches out and you go, yes, I want to find out more specific about the alternatives to me, then we'll get that. So we're going to get into what those alternatives look like. And essentially, this is a comprehensive, integrative approach to healing. So in our particular office, we look at the idea of regenerative medicine. And regenerative medicine is the idea of, can we stimulate and create healing first? Recognize that oftentimes pain is related to inflammation. It's related to soft tissue damage. So we have to create healing and repair before we can restore function. We look at gel shots or viscosupplementation. How do we add cushioning to the joint so that we lessen the amount of wear and tear and we buy you greater function and endurance? How do we tie in physical therapy in the combination and the use of these particular facilities or these modalities? And I know some of you have been through all of these approaches before, and you've done them disjointedly. You did steroid injections, then you did gel shots, then you did physical therapy, then you did pain management, or you even did regenerative medicine. What we're looking at is studying the comprehensive nature of this and how does it work together. So let's take a look at that. And the first thing to understand is that your body goes through a systematic approach to healing, and recognize that your body has an ability to heal and repair, but it needs the resources to do so. In phase 1 of treatment, we have to look at reducing pain and inflammation. We have to look at beginning soft tissue repair. We have to stabilize structures, and we have to mobilize fixations. So we look at these treatment options in combination and specific to you. So regenerative medicine, PRP, trigger point injections, Hyaluronic injections, other joint injections. How does spinal manipulation or alignment and positioning take place? What about movement and positioning of the extremity itself? Secondary areas where there's compression, so we use decompression techniques, or muscle and ligament work, manual therapies, and then the suite of physical therapy modalities like electrical muscle stim, infrared, ultrasound. And so it is a very systematic approach. If you are looking for a magic bullet solution today, hey, here's the one thing to get, this amazing outcome. We don't have a one single thing that changes all of your knee pain. We have a system that's been proven to work over cases over a great amount of time. And so that's what we're here to help people with. And so relief care moves into corrective care, which moves into strengthening. And so it is a process that we're really good at here. So let's look at element one. Element one is regenerative medicine. And the first thing to look at is regenerative medicine is promoting a paradigm shift from conventional measures, which really were about covering up your pain. And now we're promoting the regenerative process, the healing of soft tissue, the stabilization of ligament and tendon around the joint. We're looking at using blood-based products like PRP, or we're looking at amniotic products that have a tremendous amount of growth factors and cytokines to create healing. And then in some cases, using stem cell products and tissue engineering products. So our role has been to study these products and look at, on a case-by-case basis, which is going to create the healing and repair that you need, and work in combination with your particular set of conditions to drive the result that's needed for you. We have a suite of regenerative products, including live stem cell products like the Corticosteroid product by Biotech, these amniotic matrix and amniotic membrane products that promote soft tissue healing and repair, Amnio Technologies product called Pallagen, which is a cryopreserved product that we are seeing some insurance coverage for. Russell Health has a flower flow product that is attenuated acellular healing product that helps shift the inflammatory process, stimulates soft tissue repair, and modulates the scar tissue formulation. And then Exosomes. So we'll get into these. These products are safe, they're effective. When we have the discussion, if you want to continue the conversation, let's set up a time to do that, and we can discuss which products we'd use with you, and then we can get into the nitty-gritty of how these work. In the regenerative process, everything under this list here would fall under the regenerative products. And regenerative means it's going to stimulate your body to create an increased amount of healing and repair into the target area. And we see that kind of most conservatively as PRP, that's using your own blood again. And then we have these amniotic products, amniotic fluid, amniotic matrix, amniotic membrane, which have a lot of the cytokines and growth factors. And then we come over and get into the umbilical cord products, which do have viable mesenchymal stem cells. And these are of a young source. And then we can look at bone marrow or adipose. These are becoming less and less frequent. Adipose isn't really used much at all currently because of some FDA guidelines. And bone marrow is used a little bit more sparingly because of its stress on the body and some of its limitations to healing. This Amnio flower flow product inhibits scarring. It regulates inflammation. It does not have an immunogenic response, so it's generally very safe to use over a broad spectrum of patients. And there's very minimal negative reaction or rejection to it. It's antimicrobial in nature, and it adds the peptides that help protect a very safe application here. So we use Amnio flower flow in quite a bit of cases to reduce inflammation and kind of help recruit your body's own healing process. Pallagen is another product in that same realm of amniotic tissue products that contain key growth factors and an extracellular matrix that really generates and boosts your body's ability to heal and repair. PRP is a very good complement to these other products. Once we start the regenerative process, PRP can be very, very complementary to this. And so we use PRP as a staged process in the sequence of creating healing. So sometimes PRP isn't enough on its own, especially in the patient population north of the age of 40. But if we do a regenerative process and then we kind of want to add extra fuel to that process, PRP can be a great consideration there. And then exosomes are getting a lot of the current press within the regenerative space, and that's because of their really super high concentration and healing approach. And so there's more than 200 signaling proteins here. They're anti-tumorigenic, they inhibit cell death, and essentially what they do is they start to mirror healthy cells and allow your body to start to replicate healthy cells in a very, very quick nature, while asking your body to help your body to start to downregulate those bad cells. So it helps eliminate and move through the transition of poor cells faster, and helps turn on the messenger RNA so that your body replicates the healthy cells faster. And these can be injected directly into a targeted area with a very targeted response into an area like a knee, into the interarticular surface, underneath the kneecap, or even into the muscles and ligaments. And that's something unique about our injection process, is we really try to target the area where healing is needed most. Where some other companies and other strategies in injection are, hey, if we get this product close enough, it should do its own job. We found that being very, very specific in the targeted approach, whether that's under the kneecap, into the ligament, into the soft tissue, into the bursa, or into the joint itself, produces a greater result and stimulates greater recovery, which then moves the patient through that healing process, moves them through the phases of care, and makes these secondary approaches like physical therapy, exercise, chiropractic, bracing, manual therapies, makes those much more effective. The beauty of our on-site physical therapists is we have a doctor of physical therapy now on staff. She also works very closely with our highly trained physical therapy assistant. And we develop individualized protocols for each particular patient. And so I know there's several patients on patients of ours, or people that have worked with us that are on the line here, where you might have done a standalone treatment, or you did rehab, but it was prior to us having our physical therapist. We have found much greater outcomes when we do a regenerative process, we do some stabilization of that joint, and then we get you in one-on-one with the physical therapist. So while we were doing a good job before, we've strengthened that by including our on-site licensed physical therapist. And we can start to accelerate that rehabilitation nearly immediately after this. So one study said that in the acute phase, it's wise to initiate luting as soon as pain permits. So once we get your pain levels down and we have healing agents in the area, we start the loading sequence so that early mobilization and loading has a positive effect to promote collagen reorganization and soft tissue healing. And we found that to be very effective. The same study found that a majority, greater than 60% of patients with with knee arthritis, reported that there was instability. So what we found is not only is there cushioning loss, but often there's instability of the joint. So you start to get this shear process. So when the knee is loaded, it's not only the cushioning in the middle that's lost, but when there's weakness in the ligament, the joint shears. And that takes away from the stabilization. And the only way that we know how to re-educate that is to promote soft tissue healing, stabilize the structure, and then retrain that through neuro and muscular and ligament re-education. So again, we customize the rehabilitation process. There is no shortcut to this. There's no shortcut to healing. There's no shortcut to long-term outcomes. We have a suite of physical modalities that we have found that, manual therapies that also help this. Manual therapies are things that we do to the muscle, tendon, ligament around the process to healing. So we found things like instrument-assisted muscle stripping, where we use these tools to kind of scrape and break up adhesions. What we found is in the connective tissue, the fascia, there is this underlying web of fibers and tissues that get all inflamed and sticky, and they limit movement and motion. And so once we initiate the healing process, we have to address the fascia and return that tissue back to its normal pliability. And so instrument-assisted muscle stripping is one of those things that can really be effective there. Now, I know that that term may not sound very appealing, but generally this is very easily tolerated, feels good, and patients recognize a difference in that area. The other thing that this can do is it releases its own stimulation of healing agents. Again, your body has an ability to heal and repair. When we do regenerative medicine, followed by physical therapy and load and unload activities, and then we break up the adhesions within the muscle or the soft tissue, the fibers, it reduces its sensitivity, and then it triggers the body to continue to spike the healing response. A recent study shows that a patient was better able to obtain physiological and accessory motions of the kneecap and the kneecap tendon arthritis after we release these adhesions. And what that means for the patient, once there's arthritis, if we only treat the arthritis, we then turn into treating the secondary areas. So if you've only done a standalone approach, I think you're missing a lot of the contributors. So, and this study goes on to show that this helps reactivate the muscles around the joint, helps increase stability, reduces wear and tear, which promotes the overall healing process. Cupping is an interesting thing that people are really excited about, and we're seeing this more and more. It kind of came to light again several years back when, I'm blanking on his name now, the big swimmer in the Olympics showed up with a hickey-looking thing, Michael Phelps. Michael Phelps had this little hickey-looking thing on his back, and people were asking what happened there, and it was cupping. So cupping's a suction tool that helps us release some of the inflammation and increase the blood supply. So once we do that, we can see an increase in healing inside and around that area, which is complemented by our other suites of service. So another study showed that cupping before and after a 15-day period showed significant better results in management of knee pain, including relieving pain, edema, stiffness, and disability. The same study showed that osteoarthritis, this cupping treatment was the same effect as using 650 milligrams of ibuprofen, or I'm sorry, of acetaminophen, which is Tylenol, twice a day or 3 times a day. So what we're saying is sometimes these manual therapies not only decrease the expression of pain as effectively or more effectively than medicine, but it also increases our stability and increases our function and promotes the healing process. So dry needling is another service that we offer, and this is using little acupuncture needles to break up adhesions and those tightness and restrictions in muscle pliability. So what are people saying about us? First of all, the reminder is there is no magic bullet here. We're talking about non-surgical solutions to knee pain, and what we found is that this systematic approach to healing is what creates the greatest amount of change. And so what our patients are saying, one of our patients asked if she could share this message with you. Well, I'm getting feedback here that the audio is not coming through, so I apologize for that. We'll have to work on the technical side of that. So essentially what Vicky said here is that when she first came in, one, she was diagnosed with arthritis several years ago. And then as she put off the process, she ended up having a major event in her knee that led her to, the knee swelling, becoming grossly unstable. And essentially they said, because of this arthritis, it led to this chronic meniscal tear and instability of ligaments, and that there was nothing else she could do other than let that calm down and wait for it to kind of resolve. And then, and then go through the total knee replacement. She found us. We underwent a series of treatments, including a live cell product, a amniotic matrix product, and physical therapy and gel shots. And over that course of time, she went from being dependent on crutches to being able to walk without crutches, including walking around, fairs and festivals, which she loves to go to for hours and hours at a time. So she just stressed that she really appreciated the systematic approach, the very collaborated and coordinated approach to care. And she's doing really well and has been for the last 18 months since she initiated treatment. So that's what she had to say. We'll work on the audio, and I see some suggestions on what to do. So we'll work on that. I apologize that that's not working. So the beauty of our particular office is we have all of these treatments in one spot with coordinated professionals who take great pride in helping people feel and function better. And so I know there's a lot of suspicion of whether or not we can help, or your case is too far gone, or you've already tried particular modalities. I ask, what do you have to lose to have the conversation with us? What would, other than some of your time, you have nothing to lose. So I encourage you, if you haven't done so yet, work with who's chatting with you. Let's get you in and see if we can address your particular situation. We do all of these things in-house with a great coordinated effort. Our providers meet every morning to discuss new and complicated cases. And we also recognize if we're not able to resolve everything that's going on, we have other professionals that will refer out to and coordinate that progression of care, including advanced imaging and other pain management. Dustin, I see your comment there. Either Emily or Shana will reach out to you right now and give you the option on how to schedule. So Shana or Emily, if you could reach out to Dustin. We do all these things in office, and every morning our providers meet together. We have the ability to consult with each other and go back and forth. You don't have to wait for a referral and then get scheduled with another provider. We're going to do that seamlessly. So, and once you're our patient, we're going to do our very best to walk you through that process. And I know there's patients on here that could attest to that. Cammie and Karen, you've been through a lot of this with us. And Paul, you're getting familiar with us. So we're going to do everything that we can. Carl, I see that you're on. We're here to help you guys do the best that we possibly can. And we use these approaches to do that. So why would you consider us? Our purpose remains to provide high quality care in a safe environment. Currently with COVID, we've really stepped up our safety precautions and safety procedures. We're following all the guidelines within the state regulated level and the CDC's guidelines to reduce the risk of infection. We've performed thousands of these procedures. We're at about 1,500 different procedures within the regenerative medicine space, even more so when we include this whole comprehensive approach to care. And a great majority of those are knees. 80% of our cases within the regenerative medicine space are knee problems. So we really feel like we're uniquely fit to help you with that. We offer customized treatment plans to you. We have the full spectrum of regenerative options, from live cell products all the way down to those PRP products, and everything in between, including the spectrum of amniotic and placental tissue matrix products. And again, this is about you in your case and what's unique to you. So I don't know exactly what we would do for you, or I don't know exactly how we would help you, but we want the opportunity, and we hope that, I hope that we can do that. So most importantly, we offer an integrated collaborative approach, and we're here because we care, right? We empower you to make the decision for yourself and your loved ones to receive care. You know, one of our patients who's on the seminar right now just said that, you know, we have, that she's been through our programs and she knows about our office. And if you're kind of skittish or concerned about what we do, or that what I've shared is not really what we represent, she's happy to speak with you. So if you'd like a patient to kind of, to talk to you about what we do and hear it from a patient's perspective, she's willing to reach out to you. So I'll open it up now if there's additional questions or concerns. One of the questions I saw pop through was this idea of crepitus and joint noise. And, you know, I'm starting to go up and down stairs and I'm hearing cracking and grating and those sorts of things, but I don't have pain yet. Is this a concern? And I would say, yes, it's a concern. Certainly that joint noise means that there's either instability, there's breakdown of the soft tissue, there's alignment changes that are happening, and pain is not the only indicator of a problem. In fact, pain is generally the last thing to show up, and almost always it's the first thing to go away in the healing sequence. So if you're one of those that's having joint instability, joint noise, crepitus, grating, grinding, I think it's important that we check that out, because if we intervene earlier, the more conservative approaches are more likely to help you feel and function better. If we wait and let that thing progress down the road, now all of a sudden that joint noise does become pain. It moves from sand into the engine oil to metal shavings into the engine oil, which then results in an engine failure. So yes, joint noise, crepitus, grating, grinding should be looked at and evaluated to ensure that we're not dealing with soft tissue breakdown, alignment changes, and instability in the ligaments or tendons around that joint. Dr. John, I'll maybe turn it back to you on your side. Was there any other questions or considerations that were brought up that we need to handle verbally?
No, I think you did an excellent job covering it all. It's a lot to take in. I think for people who are really looking for non-surgical ways of dealing with their knee pain, the best and safest way for them to move forward would be for them to come in, let a good examination of them, and no pressure, just see what's going on. We could even help direct them into the right place that's best for them, even if we aren't the right fit. But maybe we can have some questions for them and help them move forward and be able to do the things that they want to do.
Cool. So I agree. And if you have any other questions, please make sure that we get those. And if we don't answer them now, certainly at your consultation is a great time to handle individual concerns, especially about your particular case and what's going on with you. You know, oftentimes we look at, you know, does insurance cover? And the general idea is, yes, some of these services insurance cover, but it's on a case-by-case and a plan-by-plan basis. So no, we can't, you know, specifically say across the board, yes, insurance covers these things or not, but we will absolutely do that at our consultation. We offer a complimentary insurance verification process. You know, the other question is there a cost to to the issue or to the consultation, and know if we transition into any cost, we will let you know that so that you're not surprised. Karen just asked, do we treat ankles? And the answer is yes, we treat ankles. It's not the most common thing that we treat, but John, you can attest to that we see great results in ankles. The issue with ankles is there's not very many treatment options out there, short of orthotics and short of boots and ankle orthoses. The medications are generally it for an ankle. So Karen, yes, we treat ankles. I know that personally you've dealt with some of that. So I think on one of your upcoming visits, it'd be great to set some time aside and reassess that and go, let's look at the suite of products that we have and see if they would be appropriate for you.
I think too, Dr. Olson, in response to Karen, yes, we do ankles, we do elbows, we do wrists, we do hands, we do shoulders. There's so many different areas that we can help people with, but today we're just trying to focus on the knees. But yes, if you have some physical concern, it would be to your benefit to come in and just get it evaluated and what is the best way to move forward.
Yeah, good. Any other questions? Please, let's include those. Otherwise, I really appreciate all of you in attendance. It was great to see so many in attendance and in response here. I hope this format communicated well. I think in the sequence, it's so important that we take individual responsibility for our health. Oftentimes we see people do this kind of situation of, oh, it's not that bad, or I'll handle this later, or there's some other priority, right? There's, somebody else is more important, or I'll handle this after COVID, or I'll handle this once things slow down. I encourage you to consider there's no better time to take care of yourself. If you don't do this now, who's going to, and when and why would there be any better time? So now's the time to see if we can help you. Now's the time to see if your condition is one that might benefit from this really coordinated and cooperative time to care. Some of the other questions that people are asking, or that kind of come up here, is how do we select the right how do we select the right suite of services for you? And that process looks like this. When you come in, you're going to first meet with one of our case managers who's going to ensure that we understand what's going on with you. And we're going to get the history, what's happening, what it's been like, what you've done, and what it's like now. And then we're going to go ahead and you're going to meet with one of the doctors. You'll either meet with myself, you'll meet with Dr. Lydia, you'll meet with Dr. Kevin. And we're going to kind of continue that conversation. We're going to dig a little bit deeper and find out, are there secondary or tertiary areas that are bothering this? And we're going to kind of look at the whole history and kind of paint the picture of, was this related to, just a new thing, or has this been ongoing and over time? And then we're going to transition and talk about what treatment solutions might be right for you. And we'll go into a detailed question and answer, and we'll kind of ping pong that back and forth to ensure that we totally understand your questions, your concerns, what your needs and wants are, and really most importantly, like what your motivating factor is. Like, why do you want help? Do you want to feel better? Do you want to just get out of pain? Do you want to lose weight? Do you want to travel? Do you want to play with the grandkids more? Do you want to exercise more? Do you want to play more golf? Get back into these activities. Some people, just want to don't live the pain life. I heard a patient just say one time, I just don't want to live in my chair anymore. And so really what we want to know is what's specific to you. And then we'll look at your particular situation and see about specific treatment options that are right for you. And then if you agree, then we can transition into doing a comprehensive evaluation. And that's where we bring Dr. John in, we bring myself in, we do a full functional assessment. And in that, then we have the picture to see if we can help. And then our providers collaborate and go, yes, this is a suite of services that's right for Mrs. Smith. And then we present a treatment solution. And
Dr. Olson, if I could say something, many people will say that I can put up with whatever I'm dealing with. My knees are bad, but I can live with it. The problem with that is you're thinking about now and not like 5 or 10 years from now. If you wait until it gets really bad, then that limits your options. If you're at a point where it's becoming a focus of your life, then it is something that needs to be addressed. And the longer you procrastinate or put it off, the more you become limited in what assets are now available to you. So if there is an issue or concern that's starting to bother you or not enable you to do the things that you like to do, it should be addressed now instead of waiting until later when possibly, again, you may not have as many options as you would like.
Yeah. And so some other detailed questions that are being asked are like, how long is the appointment? We reserve an hour for the first appointment. It doesn't always take an hour, but we reserve an hour for you so that you have plenty of time to answer your questions and concerns. And we want to ensure that we are giving of our time. And so that's an hour. Somebody also asked if we can do medicine visits. So if that is a need for you, then certainly we can initiate the consultation via telemedicine. We can do that via a Zoom call and at least handle the initial considerations and questions that you have. It's really tough to address a physical situation by telemedicine alone, but certainly we can initiate that process via telemedicine. I think one of the other things to consider is as time has gone on, we've been in this space for 5 years with the inclusion of regenerative medicine. And in the regenerative medicine space, things have changed drastically, and they continue to change, and they're going to change. So we like the opportunity to assess a condition from a new approach. So if you've been here before, you're an existing patient, we still can set aside the time and just really see specifically to you. I don't think you have anything to lose. And we can address that on a new basis. One of the other questions that, do we treat other areas, and what about spine considerations in degenerative disc disease and those sorts of things? And while degenerative disc disease and neck and low back conditions become more and more complicated because of their nature, that's absolutely in our bread and butter, and we treat a lot of them. Again, they have to be addressed on an individual basis. We have to really understand what's going on there. And oftentimes we have great treatment solutions in here, or we collaborate with more advanced procedures in addition to what we do. So if loved ones have additional areas of complaints outside of knees, certainly we can assess those. We can do the same consultation to address these other areas as well. So I'm just reading a note here. I'm not seeing a lot of other questions. If there's other questions, please make sure that you include those. Otherwise, I really hope you take it serious to consider that now's the time to see if we can help you. We're not going to waste your time. We're not going to waste your money. If we don't feel like we can help you, or there's not a new option for you, then we're going to give you that information as well. We're here to help. Our purpose has been to help as many people get and stay well as we possibly can. And if we haven't made any, if we haven't scheduled you yet, we'll still give you a follow-up email to this. You'll get our office number. Know that we're here to help, and we really just want to be part of a natural first approach to your healthcare so that we can help you feel and function better. John, do you have any last closing comments?
No, I think you did an excellent job, Dr. Olson. Thank you. And I think if anyone has any questions or concerns, the first thing you need to do is just speak up and we can help address them.
Great. So again, I thank you for your time and attention. I appreciate everyone being on the call. I want to give a big shout out to Nate, who is inside of our office, who's helped pull this together. We hope to do many more of these on different topics. And I just want to close with a very sincere thank you to you all. I hope that we have the opportunity to help you feel and function better. Stay safe and stay well.